Well, good afternoon. I'm Robin Fernandez and represent Messi Munchin India, the organizers of IFART India. On behalf of IFART India and All India Institute of Local Self-Government, we extend a very warm welcome to the industry leaders, our panelists, and our community of attendees. We thank you for registering. We know that we have close to 900 people who have registered, and we hope to see a lot of you log in as well. We are certain that the next hour will have some good discussions and insights from our panelists. IFART India is a leading environmental technology trade fair that brings policymakers, key industry players, thought leaders, and innovators from across the globe together. To get us thinking today and to strongly pave the way forward, I am glad we have some distinguished speakers, our elite panelists, sourced from the industry, and they are the reasons you have logged in today. We thank you for accepting our invitation today. The discussion today is being recorded and will be shared via YouTube soon after the session is over. I now hand it over to Mr. Ajit Kumar Jain, the Senior Advisor and Director for Center of Sustainable Governance, All India Institute of Local Self-Government, to take the proceedings forward. Over to you, sir.
Thank you, Robin. I once again thank All India Institute of Local Self-Government and Messi Munchin for organizing this webinar. And once again welcome all the participants and the esteemed panelists to the second webinar in the series on the impact of COVID-19 on urban development and how the cities are tackling the pandemic. In fact, the subject can be worded slightly differently as well. Like, what is the impact of pandemic on the cities and how they're coping with that? And how will they cope with the future impact of COVID-19? As we discuss the subject today, the pandemic has already impacted more than, I believe, 3 billion people worldwide and more than 30,000 people in nearly all major cities in the country, in India. As projected, it will take a while before normalcy is restored. How normal will the normalcy will be is something, which is for all of us to guess. How are we going to contain the spread of COVID-19? How are we going to protect the frontline workers, including waste management staff? We all know that most cities in the country, leave apart a few, have very limited resources. How are they going to manage the situation with already a very weak revenue base? Lockdown of economic activities has hit their revenues as hard as it has hit the people in business and workforce. These are all the challenges we are facing. Are we learning some lessons also how to run our cities more efficiently? There's an opportunity in the crisis. Can we explore to find out how we could economize while providing basic urban services in times to come? And more particularly, what is going to be our response in terms of restoring cities and, for that matter, country's economy? The worst affected in the pandemic are the urban poor. I think all of us will agree, who are living in informal settlements, extremely high densities, and workers in the informal sector. Is there a case, therefore, to review our policies on city master planning, development planning, or maybe town planning? Or do we need to review our housing policy? Do we need to review the strategy of urban poverty alleviation? These are the issues to be answered. Digital technology has been the lifeline during the lockdown. Can this become a new normal in governance and businesses? So these are some of the issues that we might have to deliberate, or we can deliberate using advantage of this platform and try and reach some inference, which then could be referred to whomsoever authority which is concerned with these issues. So with these opening remarks, I will quickly go on to introduce the panel of experts that we have today. We have Mr. Kunal Kumar, who is the Joint Secretary and Mission Director, Smart Cities in the Ministry of Housing and Urban Affairs, Government of India. We have Mr. Rohit Kumar Singh, who is the Additional Chief Secretary, Department of Health and Family Welfare, Government of Rajasthan. I hope he has joined. Is he there? Well, anyway, probably he may join it later perhaps. We have Mr. E. Ravindran, who is the Member Secretary of Maharashtra Pollution Control Board. We have Mr. Mahesh Pathak, who is the Principal Secretary, Urban Development Department of the Government of Maharashtra. And till very recently, he was holding the portfolio of Principal Secretary, Food and Civil Supplies Department. We have Dr. Dinesh Mehta, the Executive Director, Center for Water and Sanitation, CRDF, CEPT SAP University, Ahmedabad. We have Wing Commander Satyam Kushwaha, who is the advisor, Geospatial Analytics, Ministry of Road Transport and Highways. And finally, we have Mr. Amit Paturkar, who is the Director IDH at the KPMG. So we have got a very knowledgeable, very powerful panel of speakers today. And I think without much ado further, let's straight away go to Mr. Kunal Kumar, and I'll request him to speak on the smart urban management during COVID-19. Kunal, over to you, please.
Hi, everyone. First, I'll just check on the mic. Am I audible? If I see some raise of hands, maybe I understand that I'm audible. Yeah, okay. Thank you, Jayan sir, for inviting me to this. I'll keep my time. I think because I'm the first speaker, I will try to zoom to the larger issues that our cities have been facing and then gradually narrow down into how they are responding to it. I think the first thing that has clearly come as a realization to all of us is that the roots of globalization are very deep. I think political boundaries have faded. We've come to know that humanity will sink and swim together. And it seems as if cities and supply chains are things that matter more now than political boundaries that divide countries. And you can see the virus has clearly shown that trend also. The second deep realization that I think all of us have got from this crisis is about the socio-economic concessions that all of us have collectively. What is it that competitiveness means for us? Do we think that the sweatshops that we used to talk about in China and the kind of labor, working conditions that we used to see, are they going to be the more normal post the crisis, or are we going to say that, well, there is a place for dignity and there's a place for a different kind of competitiveness that India will face going forward? So this has actually raked up a lot of issues on our socio-economic consciousness. The third is about missing markets. We never knew there were some markets were needed. Online education, for example, better healthcare, emergency response, food security, migrant labor. These are missing markets that we need to cater to. So the fourth one, I think, is about technology. It's about the appropriate use of technology to create access to services. There's this differentiation between income inequality and access inequality. Time again, we keep talking about how the society is getting divided among the poor and the rich between incomes. But now I think it's more about access to services. Even though you may have differential incomes, then you have access to good quality housing, good quality water, good quality sanitation. And can you be able to provide that despite the rising inequalities in income? And that's one fundamental thing that has come out of this crisis. Fifth, of course, is the broader definition of resilience. Resilience is not only about natural calamity. Resilience is about a broader, much bigger dimension that we need to, an infusion of the larger context in city planning is going to be important. The sixth is about the safety nets, the issue that you talked about, urban poor, the vulnerable, living in informal settlements. And there are so many things. My children can actually join classes online, but I don't see municipal schools working online in many places as of now. It's about sanitation, jobs. How quickly can you lose jobs? How quickly can your life completely change? These are things. The seventh is about the challenge that we have in data. I think there are lots of parts of our society and lots of parts of our apparatus which we do not have adequate data about. And then when you face a crisis, you face a challenge is how to respond because you don't know how much is the crisis and how deep is the crisis. Eighth, of course, health and education infrastructure. And time and again, we think that, Look at our municipal budgets, look at our state budgets, and how highways and bridges and infrastructure gets more prominence than health and education. And these are some things I think that need to be fundamentally realized as basic human needs instead of being kept in the same thinking as far as infrastructure and other things are. And therefore, we probably need to set new benchmarks in how we think about these things. Ninth, very important point that comes out of this crisis is the role of decentralization. I think because there's a crisis, cities have been given the hand to go ahead and take steps. They have shown innovation. They have shown bottom-up thinking. And one of the things that I think has come out of this crisis is there is a lot of decentralization that needs to happen. At normal times, the cities work as if the infantry on the border is actually asking for command from the headquarters, which is thousands of kilometers away, all the time when they're trying to deal with situations. The crisis has shown that they deal better if they're more involved. And the 10th and the last point I want to make is in the flexibility tools and processes of government. So with that, I'll actually come to what the smart cities are doing. In fact, these 10 points are common to all the cities. But within the smart cities, the moment we realize that there is a crisis, and in fact, in the second week of March, we all huddled together. And you would be happy to know that we've been having a daily 10 a.m. call among cities and daily 9 p.m. call among the different partners. So we've been apart from maybe a day or two in between for the last 1 month, talking to each other. There's a lot of sharing of good ideas happening. And that's been visible in the response of smart cities. I think the 4-quadrant approach, which I should talk about for easy takeaway of what I'm trying to talk about. The 4 quadrants are information, communication, management, and preparedness. I think information is all about how you make yourself aware of the dimensions of the problem. Communication is two-way, how you reach the right facts to people and how citizen grievances and needs come and become known to you. Management is, of course, about lives, livelihoods. It's about essential services, about health. It's about equipment, resources, coordination between different departments. And the 4th is preparedness, where you actually use data, artificial intelligence, and whatever tools you have. I mean, human intelligence, I call that RI, which is real intelligence, to actually garner information about how things are going to pan in the future. And all said and done, let's be humble about the fact. Let's not start to beat the drums and say that we've performed well or we've been handling the crisis well. There are cycles in a crisis like this, and we have to be prepared for the future. I think there has to be 3 clear frames in which we see our response. One is the short term. The second is the medium term, which is going to be about a year. And the third is going to be a 3 to 5 year roadmap. And all of these are going to require a lot of ingenuity, a lot of local contextual thinking. We'll have to move away from the glamour and infatuation that we have about global best practices. I think we will have to evolve our own practices in the local context of India. And we'll have to do away with this experts hat and we'll have to actually start to look for the doers hat, people who are actually performing services on the ground. This is a time for all of us to salute the frontline workers, municipal workers, the sanitation workers, the health workers, everyone, and to stand in support of them and ask them what they need to solve this crisis instead of making our own thoughts on it. So I'll stop here. I think that's where we are in a crisis, fighting a crisis, and preparing ourselves to fight even longer.
Thank you very much. Kunal, I think we'll come back to you again. You finished not only within time but much before time, but I think there'll be a lot for you to share with the participants later in the webinar. I don't think that we have Mr. Rohit Kumar Singh. Is he there? Is Mr.
So,
Singh
sir, you
here?
can go to the next speaker.
Yeah, I just wanted to confirm that. So we now go to Mr. E. Ravindra, who is as I mentioned in the beginning, Member Secretary of the MPCB, and he's going to speak on managing environment during pandemics. Over to you, Mr. Ravindran.
When you look at COVID-19, which has given more negative impact across the globe, in terms of environment, it has given very positive impact, though it's very Sad to say, at this situation, it's a positive when the globe is facing this kind of problem. But you look at the data or monitoring mechanism which we have, it shows that the air quality index in across the globe, we can take China also, we can take it New York, or we can take it Mumbai, almost 50% reduction in air quality pollutions, we can say 50% reduction in pollution in Mumbai, as well as in New York. If you see that China, they curtail almost 40% use of the coal. So it shows that across the globe, the air quality is much better. And it gives actually, maybe after the industrialization, this is maybe the time which is a long gap where the air quality index could be able to have the proper baseline for the future development, how the technology can be used, or maybe we can make a better monitoring mechanisms. In terms of water quality, if you see, I think all domestic, there is not much change in the domestic sewage systems, but wherever the industrial system, because of the industries are shut down, the water quality index also, it shows the improvement. When you look at the waste management, I think the waste management is almost 25% reduction in the waste management because of the many of the human activities are shut. So in this case, the waste management is actually, when you look at the waste management in this scenario, I just want to go little more detail on the biomedical waste management, which is more relevant at this point of time. Though the 25% reduction in the solid waste management, but there is a waste which is from the biomedical field, which is actually more important to handle at this junction. See, Maharashtra, for example, I'm just telling, almost 62 tons per day biomedical waste being generated, out of which now it was to till today. If you see that COVID maybe handled cases of waste, it's almost 10 tons per day. Last we are just looking at this 10 tons of COVID infected waste. It's quite enough to spoil or maybe they infect entire India, I think. So the most important is how we are going to take care of this waste, which is being properly treated and disposed of. So here the responsibility lies with everybody, including the citizen, healthcare establishments, even the local bodies, and the common treatment facility operators. So in this, the various guidelines have been put up by the Central Pollution Control Board, Maharashtra Pollution Control Board, even ministries from the Government of India, state governments have given so much of guidelines. The more important is that whether the citizens are aware about it and do they have adequate training, even including the healthcare establishment staff, even the waste management staff. For example, in the quarantine home or quarantine area, whether these rules are strictly followed, or do they take adequate care and it's properly treated and disposed. This is most important. I need actually, when you look at the data from the Maharashtra, I can say very clearly that the proper management, taking care of the waste management of biomedical waste or solid waste. When you look at the entire solid waste also has the probability to have contamination of the COVID-19. But when you segregate this particular waste from the solid waste, the biomedical waste, whatever the people use for the PP, for example, mask they use, or maybe hand gloves they use, or maybe the head cover they use, or glasses they use, it can be used. They have to properly sanitize and use, or which cannot be used. When they throw it out, they have to disinfect at the home level or the healthcare establishment level. Then they should dispose it to the common facility. Then the common facility should take it properly, and they have to disinfect it or maybe treat it in incineration, and they will dispose it. This is how the mechanism is developed. So when you look at it, the post-lockdown methods, when the people started the activities, what they should take care of it. Every individual responsibility is actually put forward here. So individual citizens has to take care that what kind of material they use, whether it is sanitized properly or it has been disposed properly in the right path, which is defined. For this, actually, the local body should take more interest and give some awareness mechanism among the public. When the post-lockdown comes, they should be much aware that what are the material they use and what are the material to be segregated properly and handed over. I can advise that now the 2 bins concept or 3 bins concept is already there, but the local body can encourage the citizens to have the yellow bags, which is basically used for the biomedical waste. And they can provide yellow bags, which is permitted by the rule, and they can use the yellow bags in every household to keep this properly used. Whether it may be used the mask, they might have used hand gloves, these can be kept in this yellow bags, then hand over to the local body, and they can actually give this to the common facility operators. So it can be treated like that. When you go little more detail into the environment aspect, if you see, since the whole activities are slowed down, maybe many of the activities are closed. Now the environment gives the better quality index, air quality as also, water quality also, in terms of the waste management also. This gives actually the right time for us how the future environmental monitoring system can be put, and what would be the baseline after almost 150 years. This is the longest breakdown, and which has given the longest baseline data for the entire globe. And this gives the how much emission of the carbon comes from which particular unit, or how much different pollutants comes from which particular area, or how much particulate matters comes from which particular area. So it gives a very good background data. This background data will help us to how we can bring down the pollution back to the prior to the industrial revolutions. So this is the right time to actually sensitize all the, we can say, the government missionaries also, all non-government organization also, educational institution. Everybody can use this particular platform or maybe basement data to predict the future environmental monitoring as well as environmental protection things. I think, sir, I stop here. Maybe.
Great. Thank you very much, Mr. Ravindran. It was really exciting. And definitely we'll come back to you once all the speakers have done one round. Can I now go to Mr. Mahesh Pathak? And as I introduced him in the beginning, he is the Principal Secretary Urban Development in the government of Maharashtra. And before that, until recently, he was the Principal Secretary of Food and Civil Supplies Department in the state. So I'm going to request him to speak on state perspective in COVID-19 response. Can I request you not only to talk about the response of the cities, but a little flavor of how the essential commodities are reaching to the people. Over to Mr. Pathak, please. I think your mic it needs to be unmuted.
Yes, sir.
Yeah.
Sorry, sir.
Yeah.
So, Jain sir, well, thank you very much. I was asking whether I should take up food first, or you want me to take up the response to COVID first. So,
up to you. It's purely your discussion.
So the first thing I'd like to start with the positives, like what we have learned in the cities particularly. So positive is that since we are very good at personal cleanliness, now we have realized after such Bharat mission, this is the second opportunity that we have realized the importance of public cleanliness, particularly sanitization, maintaining distance, masks, and all kinds of when we move in the public areas, what are the safeties and precautions we need to take as individuals. So then areas either too inaccessible, they have been accessible now, and most of the corporations are working on these areas because now there are no people or traffic moving around. So some of these inaccessible areas, and it's related to the maintenance and upkeep. So some of these activities are now being taken up. Work from home. So actually efficiency has improved, I would like to say. There are less number of people to manage and the coordination is better. We are still be able to function. So that is one area which everybody has realized, government, local bodies, that we can work with lesser people if we use technology better. Because we have been using WhatsApp very extensively, also been using Zoom, like presently we are using. VC is of course the only way in which we are communicating. There are no physical orders moving around. They are all on soft copy. So these are some of the positives that have come out from, some of them which I could imagine have come out from this this disaster. The other is that like Government of India has now appointed teams for certain areas. So in Maharashtra we started in the mid of March to tackle, we started with domain areas. So like about a dozen people were specially identified for these kinds of work, and these were like how to deal with camps for the migrant labor, how to deal with people from outside of the state which have been stuck in Maharashtra. So there is a separate officer for camps which the collectors are having for the migrant laborers. And we had one of the highest numbers in India. We had more than 12 lakh people in the camps being fed. And the number of camps is about 5,500. And out of state people which are stuck, so there were many calls to the chief secretary, to the chief minister. So for that, a separate helpline, a WhatsApp group was set up with other states. Other than search and find or find and rescue operation. Like many of them said, "Mera aadmi yahan phasa hua hai, usko khoj ke lao." So we cannot do that kind of thing in this situation. What we can do is that you tell us a number, we'll provide all help. We'll take him to the camp and give him food. So that was the second one. Then there's another officer for specifically for tracking or for tracking of cases. So he's coordinating with all the urban local bodies, particularly where the cases are quite high, and he has a record, up-to-date record every day. The reports come. He also looks after the figures. That is the number of cases which have been reported. So there is a separate officer for that. Then food, of course, I was given an additional responsibility along with urban local management. Look after PDS food only PDS food. Apart from what is happening in the camps and what is happening to out-of-state people in Maharashtra. Except for essential supply, other than PDS, there was another officer who was coordinating with all the traders, with all the people who deal with essential commodities, whether with their oil or sugar or pulses or grains. So he was coordinating with them, and also all the malls and all the aggregators to have proper delivery systems. He had a big interface with the police because that was the one place where we have to get passes. You have to see that it is functioning properly, and problem solving, because only coordination is not enough. Whenever an issue comes up, including of production of health, pharmaceuticals, health, all of that was one officer. Then there was another, the control room SP was with us, the law and for law and order issues. So wherever some exceptions were to be made, or wherever the interpretation of the directives was too strict, or there was some confusion, so there he would intervene. Then for fundraising for the CM fund or from corporates, or kind of, there was a separate officer. Health and medical education, of course, they're there. Then publicity, because there was a separate person looking after publicity. Then there's also one control room, where the normal control room, but there was a senior officer appointed to the control room to be overall in charge and to coordinate many of these activities. I would say that with this domain area, like now I can move on to what happened in PDS in food. In that particularly, we have been able to serve about 10.5 crore people out of the 12.5 crore projected population of Maharashtra. So 7 crore we did through our normal PDS, that is our NFSA. Remaining 3 crores, we had our own scheme for those people who are not covered in NFSA. And Government of India gave us a very concessional rate for that. And still the expenditure is about 225 crores a month. So for 2 months, we are providing them grains. And the third one is the farmers are already covered by about 50 lakhs. So total 7 plus 3 plus 0.5, that is 10.5 crores we are providing grains. And from the day of the decision, we have been able to move the grain to the shop in 14 days flat. So that is one of the achievements that we have been able to in 14 days, because if there is an announcement, then after that, there is a lot of process which goes through. And there is a two-step transportation from FCI to our godown, then from our godown to the shops. So all this was smoothed in such a way that even though the machinery is working about 2.5 times, because like 7 crores, they are now doing 10.5 crores. So even if they are doing 2.5 times the work, they have been able to do it in half the amount of time. So that is one thing that we have been able to do. And portability has helped a lot, because portability came because we could introduce the online system with the POS machine. So about 7.5 lakh families from other parts of the state which are stuck in some different part apart from their shop, they could take the grains because there is portability. So these are some of the achievements in food. Government of India is now supplying the free pulses also, 1 kg per family. So that is being supplied now. We have done regular, we have done free grains, as well as now we have started for those who are not covered under under PDS, we have started the supply to them. So some of the issues which came up, of course, labor, transport issues, police, a lot of coordination with police, safety and security of the sweepers and of our persons who are on the road. So these are some of the points that I wanted to highlight. About major challenges for identification of cases, of course, that is every state is doing that as per the directives from Government of India, and the directives are being modified, being updated. The changes keep happening, advisories keep coming. So everybody, every day or every 1 or 2 days, there's some change in the thinking, because now you can plan only about yesterday, today, and tomorrow. There isn't much more to do other than that. Prepare for the future, but this is like when you are working in the nitty-gritty of the thing is that you don't have too much of a long horizon. So this is what is happening. I'll be happy to answer any other question which is there at the end of the seminar. There's one area which there was advisory from Housing and Urban Affairs also. There were a couple of webinar on Zoom. There were a couple of VCs. There was one issue which has not yet come in the advisory. This is sewage management. Because sewage also, just like solid waste, there is some presence in sewage. That is the recent studies which say. So, and that is, but it is very difficult. It is already all right to recognize it theoretically, but separation of sewage from these affected areas is one thing which is a question. So, thank you very much.
Thank you, Mahesh, for giving an overview of what Government of Maharashtra is doing in terms of fighting the menace caused by COVID-19. And I'm sure there will be many questions for you, which we'll take up towards the end. Now, can I go across to Dr. Dinesh Mehta? And can I request Dr. Mehta to speak on the strategies for WASH in response to COVID-19? As Mr. Mahesh Pathak pointed out just now, the issue of sewage management, and prior to that, Mr. Ravindran talked about solid waste management in general. So WASH, which covers water, sanitation, and hygiene. I think we can learn a lot from Dr. Dinesh Mehta. Over to Dr. Mehta, please.
Thank you, Mr. Jain. And if you remember 10 years ago when we met in your office, we started the water sanitation monitoring in Maharashtra. And that exercise that we started for 300 cities in Maharashtra is now extended to almost 900 cities in 6 states. And hopefully with Mr. Kunal Kumar's support and encouragement, it will be extended to another 100 cities, the smart cities, etc. So that exercise that you started in Maharashtra 10 years ago is still continuing. Couple of weeks ago, when we were talking to Mr. D.M. Suktankar, whom I guess all of you know well, we said that there's something unique about the urban local governments, that in the normal times, people seem to have more complaints about the local government. But when there is a crisis situation, somehow the local government responds to the crisis in a way that is unimaginable. And that's exactly what has happened. We've been working in Maharashtra with our team that is stationed in the Swachh Maharashtra mission. And we've been documenting the work that the local governments are doing in Maharashtra. And it is amazing to see that even the small towns and how they are taking all those directives and advisories that are coming from the state and national government. So they've been working really hard. So along with the health workers, as I think some other speakers said before me, that our municipal workers, sanitary workers, and all of them, I think, are equally on the front line. And this is something that in big cities, we have sewerage system, but in the small cities where we are working, we have the on-site system where there is the desludging that is going on. And in many cities, it's the private desludging operator who is providing that service. So large number of cities have responded to this. They have encouraged the private desludger to come, and they've been given the necessary permissions to operate. So I think this is something that is really going on. Mr. Pathak mentioned a very important point on sewage. And we've been doing a little bit of research in that. There's a group of researchers from Netherlands who have been tracking COVID virus in sewage system. And Australia is now beginning to attempt that. We have found that in Bangalore and Calcutta on a pilot scale, there is something that is going on. So we've been looking, and our funding that is coming from Gates Foundation is now asked us to see if we can do this on a pilot basis. And the idea is that in a hotspot, you already know that these are the areas where there are cases. But in a green zone, where there may be asymptotic cases and we don't really know what is happening, one could start taking samples to see if there is a COVID presence. Then we get into the second stage. So this whole community surveillance system is a quicker and cheaper way to do it, and something that if Maharashtra, Mr. Ravindran, and if Mr. Pathak is agreeing, we can begin to see how we can get Maharashtra cities, or at least we can do some pilot projects in those cities. A second important concern that we have about Maharashtra is that it's a state where the dependence on community toilets is very high. Now, Mumbai is one of the unique case where I think 22% of the population depends on community toilet. But you know, both Mr. Kumar and Jain, you've been in Pune again, where you see large number of people dependent on the community toilet. Now, in the COVID situation, this is a very, very difficult area to manage. We have all the social distancing. I mean, we did a good practice documentation. So we have seen we can mark all the spots for social distance, but these community toilets will have to be disinfected more regularly than ever before. Hand washing facilities that are typically not provided will have to be provided before. So I think in a medium term plan, we need to begin to think about how to shift to IHHL, what we call the individual household latrine. We know that in some cities like Mumbai, it may not be possible, but demonstrated in Pune, how individual toilet, large number of toilets were built in slum areas. And we can do that in a large number of cities. So I think it's a time to maybe rethink on our community toilet strategy, begin to talk about individual households, individual toilets in the household. We did a small effort in the city of Jalna, where we got the community groups involved, and MAVIM, which is the state level agency that has come, that organizes community groups. So through MAVIM, bank loans were made available to almost 200 households for toilet construction. So in addition to the Swachh Bharat subsidies, the households took toilet loans. And I think this is something that we can begin to extend on a large scale. So this is something that I think it is possible to do at the state level. And now my final point is about municipal finance, something that has been work that we have been doing, Meera and I have been doing for a large number of years. And we recently wrote an article for the 15th Finance Commission. And you know that and we know that in Maharashtra, and thank you, Mr. Pathak, that you have encouraged the states, cities to use the 14th Finance Commission money, whatever available to use for that. In the new 15th Finance Commission report, which is at least interim report for 1 year, a lot of untied money is gone. The big cities are getting only incentive money. And we have asked them to rethink the air pollution. As Mr. Ravindran is saying, air quality is already improving. So I think all cities have otherwise qualified for improving air quality. So we might as well request FC to shift that money for COVID response. We are asking them to put more funding onto sanitation, more funding for small and medium town where the need is much higher. And I think only then our cities will be able to take care of it. cities will now have to think about a longer term perspective, longer term meaning 2 to 5 year perspective. Mr. Jain talked about new normal. I think cities will also have to recognize that resources are going to be constrained. The grants that are coming from central government, state governments may not be enough. Cities' own property taxes, at least for the next year or so, will be affected because businesses are not going to be able to pay. So how do we manage? What is our city's resilience plan? And I'm sure Mr. Kunal Kumar and his team are working on this whole resilience plan. But I think besides cities, we need the smaller cities as well to really start looking at how they will manage the post-COVID situation. I'll stop here, Mr. Jain. Thank you.
Thank you very much for a very crisp presentation, Dr. Mehta. And I think there will be several questions to the points raised by you. I think now we go to Wing Commander Satyam Kushwaha, and I request him to speak on tackling COVID-19 impacts on urban mobility and infrastructure during and after COVID-19 pandemic. As I introduced him earlier, he is an advisor, Geospatial Analytics, Ministry of Road Transport and Highways. Mr. Kushwaha.
Good afternoon to all of you. Thank you very much for having me invited to such an important forum. I would like to start with some positives. I thank Kunal sir, who very elaborately and very nicely objectified the problem statements and the kind of areas that we want to work in. So I would like to highlight some of the things in more detail on things which he pointed out, as well as bring out some new aspects which probably would need attention. But before I do that, I would like to bring out some positives that have happened. I think what we've seen is that despite being caught unawares, the local systems as well as the governance systems have responded well in adapting themselves. We have seen a very dynamic policy response from the leadership at all levels, which is something which is encouraging. The response to containing the spread has been good. We are not seeing the kind of alarming figures, and I hope it stays that way. And that is something where I think it's a collaborative effort of all spectrums of society and political establishment, which is something very interesting. What we have also seen is a very interesting participation by the startup or the innovation industry in India, who come out with various kind of trackers and other technological applications to enable the governments as well as the industry. What we are also seeing is that there's been an increased dependence in the digital transactions, and more and more people have started adopting it, both societal perspective as well as the governance perspective. So earlier, we used to have a lot of people who were reluctant to adopt methods, but now we see that the transition is happening, and it's happening in a very fast pace. Now, before we move forward, I would just like to put some highlights on the kind of impact that we are facing. We're facing a serious impact on logistics because the number of people who are available to shift the logistics, even from the industry, even they were allowed, reduced. While some got infected, some stayed back. Then we had an impact on the trade side, both the sea cargo as well as the land, interzonal land movement, and the air cargo prices definitely went up. So it became very difficult for many of the people to manage that. We almost saw a complete stoppage of manufacturing activity, as well as we have a standing crop right now, and we need labor to cut it. Now, here I would like to point out one important aspect is that our policies like the ESMA and all, they were probably not designed to handle a nationwide lockdown. They were essentially designed to handle small patches of inactivity because of certain political or other disaster-related issues. But to handle something which is of this scale was something which I think we have learned in this. And why I say this is that there's a lot of focus right now on PPE manufacturing or medical equipment being scaled up in terms of production. So it was not only a specific raw material industry, but the entire interlinked chain that had to be enabled. So this is where I think the attention has gone, and certain corrective steps have been taken over a period of time. There were issues of law enforcement, there were issues of use of the disease, the COVID virus as a possible bioweapon. Now, this is very important, and I would like to bring out to all of you is that it probably has emerged as a cheap way of disrupting an economy or the social fabric in our nation. So this is something which has to be part of any national level response system. Also, we've seen an increased cyber activity because more and more people who are not used to cybersecurity measures or the cyber vulnerabilities are being exposed to digital transactions, and there are challenges to how their lives can be impacted should they not be made aware of the risks. Now, from here, I would like to move on to things like interesting things like, national highways. Our ministry was acted to ensure that the connectivity was maintained. There were minimum disruptions wherever repair activity or those activities could be done. They were undertaken. We also ensured that the mobility with respect to tolls and all was better handled. So these are some things which happened well. And what it brought out, if I would like to bring it from a national perspective, is that smart cities handled it well. But we also need to see that these smart cities which have some integrated command and control systems, are also interlinked to the rural economy, the village economy, where the vegetables are flowing in, and things like that. I think we need to do some more work in ensuring that the protection against the bioweapon part, when supplies have to move from a rural environment to an urban environment, is handled. And I am sure you would have understood what I'm trying to point out. Contamination and things like that. Then our ability to measure, monitor is still there in isolated penny pockets. When we look at a national level, the nation is not only about smart cities, it is beyond that. And we are lucky that we've not seen a community spread. But God forbid, if tomorrow it is COVID-19 plus pro version that comes out, there's so many strands which are coming out. We're still not aware as to have we found a solution to solving this problem. So we have to be adaptive. Something more may come up later on. So essentially what we need to do is need to come out with a comprehensive national pandemic response system, which is real time, which is reliable, and which integrates all the stakeholders. I've made some plan and submitted it to the PMO as well as Niti Aayog on a comprehensive system on it, which is based on the modular concept, which believes in plug and play of every technology that is available today or is being developed today. Reason being that we have limited resources, we have entrepreneurial capability, we have innovation available in the country. But if everybody starts making trackers, it doesn't solve the problem. The spectrum of the problem is wide. So in case we are able to handle our startup community in a better manner and say that, okay, these are 15, 20 problem statements, you bring your solution where it angle, if it cuts these standards, you're straight away in and plugged into the largest system. I think that will be a better way of handling our resources. Then there is a need to have standards built in it. Kunal sir very rightly brought out the data problem. Now, with my experience on handling the geospatial policy and the deliberations that I went on, I think I'll like to summarize it in very interesting keywords, and they are your ability to have commonality in terms of standards, interoperability, so that they bring integrated convergence. We have right now cities working, but are these cities contributing to a national level setup where the patterns and trends can be understood? Because it is not only about a medical emergency facing it. Tomorrow, if it is used an offensive weapon against us, given the kind of diversity and the variability of a demography, of a cultural practices, the political thought, it can rapidly be used in a very, very worrisome manner, I would say. So before it becomes a challenge for us, we need to have national surveillance systems built on it, wherein these different city level initiatives need to be studied properly. We need to understand what is the Indian template like, how do you leverage this template, and thereafter integrate all these subcomponents which have worked so well, and then come out with a national system. Because I thought I specifically believe that Western templates don't always work in India. It has to be an Indian-driven, Indian-led, Indian-designed, Indian-operated system. And I feel that India is the best test bed in the world. Anything that works here will work anywhere, at least on planet Earth. Now, from here, these capabilities should include our ability to measure, monitor, analyze, simulate, predict, and manage this entire life cycle of a pandemic in a comprehensive manner. Why I said simulate? It's very important. Like we had the migrant problem. If we had the tools where we could simulate that, how do we extricate this from this problem? How do we better handle it? How do you manage the urban mobility from this? I think it would have saved us a lot of grief. And human sentiment is the most complex sentiment to manage. So there, if we have some data-driven analytic solutions that can give us that initial thought and cue, I think some complex mistakes that could possibly be committed could be avoided. Then, from this comprehensive situational awareness, I would like to also say that this could better be used for optimized and efficient leveraging of our limited resources. It could also help us. And how do we handle manufacturing and agricultural, say, we are heading for the harvesting. How do we handle it in a more effective manner? Especially even if there is a red zone, should I be so scared of the red zone? Or can I be more intelligent about handling that red zone in a more effective manner? I mean, we cannot have, what if we keep having this chain of occurrences of such cases? So will we say that we'll continuously keep that area under red zone for all the time? I don't think so. That would be. We will have to fight, take it on the chin, and find out new strategies to work within that challenge. Next, I think will be that how are we handling our emergency responses? Right now, we are sitting in approaching summers. We are already in summers, but 2 to 3 months down the line, we are going to get floods in many areas. And what if we are in the impact of COVID at that time? Maybe we have a second peak. Now, how do we handle flood response in that time? So I think the time is now to start preparing for it, identify areas where probably floods will not affect us, and thereafter build something in that zone, maybe beef up our administrative capabilities in that, so that it is better handled. We'll also have to build strategies. How do the rescuers handle these people? Because at that time, when you're doing a flood relief, that guy from the Amazon, India, feel that, okay, show me whether you're COVID positive or not, only then I'll pull you out of water. I mean, I'm posing a very live situation to you. How will you handle it? So one side is humanity, second side is the challenge, and third side is a human mind which has to innovate to find a solution. And that is where I find that we need to design a kind of a set of electronic keys, the options to open this lockdown. And they will have to be electronic solutions which allow us to work under these challenge conditions, whether it is restarting the economy, because all our efforts now should be focused on either building real-time resilience, real-time response, and thereafter, how do we reinvigorate our economic response to what's happening today? How do we rebuild our damaged businesses that we have, or the startups? I mean, it's the entire ecosystem, the manufacturing. How do we get them back on track in these challenging circumstances? So I think that is another issue which we need to understand very well. And I think the most important aspect of it all would be the social impact of the mobilization of this migrant labor that is taking place. Jobs has been always a challenge. Even the educated ones have been having a challenge. And with this kind of migrant labor being pulled out of these zones, who will handle your service industry when the lockdown opens? They've already gone back to the villages. How many are willing to come back? How many will be accepted back? And the kind of logistics involved with it. Will I have the manufacturing returning back to that state since my labor is not available? Will the adequate number of people be available to harvest the fields? That is another issue. And this all depends on my ability to build a technology which allows me to communicate with the other person and says that, yes, I'm safe in real time. And that is something which, in fact, we are building on. And the next thing is that how do we handle transportation in this entire thing? Because that is what's going to enable the to and fro movement of your, whether it is your daily consumables like vegetables or items of from the manufacturing industry, the raw materials. So that is something, how do we ensure that my Ola driver is safe and fit for operations? So we need to get innovative on the opening up and lockdown management through electronic means, and as well as that assurance level that yes, what the system is detecting is right, and I have a trust factor in that. And lastly, cybersecurity is very important. So much of data that is being collected. I am a strong believer in data localization and data sovereignty. I think that is what is the future. This is a golden opportunity that has come our way to produce data. We need to move fast on this, create capabilities where this data can be adequately stored, processed with anonymity under judicial control so that the trust factor is there, and thereafter leverage it for multi-sectoral applications, which would also include employment generation, because that is one area where I think we will face stress in coming times. Reason being that technology has already brought in automation. Skill sets in the niche areas are limited. The people at the lower level in terms of skill sets, they have moved out, and getting them back into your zones will be difficult. How do you ensure that the social aspect of it is properly managed? If you now zoom into the villages, we have these migrant labor who have suddenly gone and overloaded the already fragile, limited resources that were available for the bread earners in the family there.
Mr. Bushra, can I request you to wrap up?
So this is one place which I think would also need some attention as to the social stability in the villages, which will become thoda sa challenged because of this mobilization. Thank you.
Thank you very much for an excellent, very comprehensive presentation. Just like you talked about a comprehensive national response mechanism that needs to be evolved. And I think that needs to be discussed further. Now we have Mr. Amit Utturkar. I request you to make your presentation, please.
Sure. Good afternoon, everyone. Thank you, Jen sir. Thank you, eminent panelists. So I think the panelists have already, covered all the key points that are to be mentioned. I mean, Kunal Kumar sir spoke about the importance of data on what the smart cities are doing. Pathak sir talked about all the various reforms that are, being thought about, and the facilitation, the guidelines that are being put in place, the monitoring system. Ravindran sir spoke about, the effect that is there on the environment and, how that is critical. Mehta sir covered, across various different points, very things that are critical. So there is, I will basically focus on three three things. One, just for the benefit of everyone, quickly highlight what the ULBs have been doing and what are the good things they've done. Secondly, also talk a little bit about how this is a golden opportunity and from an economic impact. What would be the economic impact, or where would the impact be, and how should we be looking at it, with a few recommendations, and also lastly, primarily with about what when and where, about the opening what I'll speak about. Obviously, like Mehta sir has mentioned very correctly, that the ULBs have actually done a phenomenal job. So while they are mandated, obviously to implement the guidelines given by the state and central government, and what is really appreciable to see that even in these guidelines, the ULBs have actually been given the rights to further make the guidelines, more stringent, or to be able to handle it as per the need, as per the local need. And I think that is what is necessary. It's a very positive thing. But where the challenge has been for the ULBs has obviously, like Kunal sir mentioned, has been the data. And data not only for COVID management, be it any programs that are undertaken, it is so critical that without proper data, the right kind of decision making gets hampered. Luckily, the ULs who've been part of the smart city mission have been able to leverage the infra, the technologies that are there, various mobile applications, whether it is converting the ICCC into a war room for COVID, the health dashboards being created, the GIS mapping, the city use of the city surveillance systems, etc. I think there are also cities, which are not part of smart cities, but have done a wonderful job. So let's say, the Nandyal Municipal Corporation, they came up with a mobile hand wash or a sanitizer facility. Sagar in Madhya Pradesh, has come up with a public siren that gets sounded off every, at regular intervals, informing people that they need to wash their hands and just reminding them continually. You have, for example, the private sector participation in Ahmedabad, where Zydus is coming in, come up with negative pressure rooms, for their hospitals, etc. The community kitchens that have been done at different places. Besides that, obviously, the home quarantine visits, the large field surveillance teams that have been put out there, the separate waste collection mechanisms for the quarantine people, along with, let's say, the sodium hypochlorite and the waste bags being given. So obviously the state and center have played a big role where, all the best practices are being collated. They've been, percolated down to different cities. Different cities have actually, tweaked things around to make it work. The most encouraging thing has been that, the corporations have made an appeal for volunteering, and the response has been extremely positive. So this, I think, shows the kind of compassion that is there in our people and our society. And I think the plans that the government is putting in place, if people are abiding by it, are supporting it, and moving forward, is particularly why India is probably in a much better situation than many other countries, or the advanced, so-called advanced countries, as we call them. Like rightly mentioned by Kushwa sir, the migrant workers, their accommodation, that is a big challenge, and this is what we are seeing. So, for example, one of the key things about urban areas is that usually it's a very, very dense society. That's what defines an urban area, right? But in cities like Pune, they've resorted to decongestionizing the slums, for example. Right? They've said, okay, fine. If there are 5-10 people living in a 10 room, how's it going to happen? So the idea is that they started decongestioning it, removing people elsewhere, giving space so that some kind of social distancing will happen. So there's a lot of positive things that the ULBs are doing. I think the challenge is more on the post-COVID management, and this is where we think once stabilizes, and we think of going forward, what is it that needs to be done for the ULBs to be able to bounce back? Let me dwell very shortly on some of the key challenges that are there with the ULBs, right? I mean, if you look at India today, almost 50% is urbanized, and a lot of the contribution to GDP actually happens from the urban areas. But if you look at the revenues of the municipal corporations, they're not in line with their contribution to the GDPs. They're still dependent on a lot of funding that comes in, through the state governments or the programs of central government. The various taxations, while yes, the central is the share of and the freedom of the state for their taxations have been increased, but if you still see the ULBs don't necessarily get a link of that basis their contribution. So I think that disconnect is somewhere which does not particular ULB or governments are all saying that what is it that can be done to further, actually in the right spirit of the 74th Amendment, enable the ULBs to truly be independent. I mean, even today, several of the key functions lie, with the state government. So, such as the land use change, the development plans, the housing, the approval for the large projects. All of these are approval to, state government. Now, while yes, it does hamper probably the speed of the initiative, the speed at which a project is to be undertaken. But again, beyond that, it's also the initiative that the ULB gets hampered. They probably don't want to take it up to there. They want to try and see if things can be structured at their level itself to be able to get it done. Similarly, we monitor GDP, we monitor SDP, but at a ULB level, we do not monitor what is the domestic product. And that is primarily, again, coming back to the point of saying that, is the data vital? How vital is that? There are so many subjects which are probably state subjects, or be it the industries. I mean, today there are so many industries that are there in ULBs, right? But there is no revenue that the ULBs necessarily get from them. And there is hence, what is the incentive for a ULB to actually drive the economic development? Now, in this specific COVID situation, if you look at from an urban perspective, the industries that would be affected, one is for sure, let's say, the construction industry, or anything to do with construction, be it housing or even the regular infrastructure. The government services, I mean, they will be impacted. And hence, the push to become more digital more quickly. And probably, this is something that we've seen, that even in the smart city, some of the initiatives which were in the pipeline or nearing actual implementation got hastened, and luckily, they were put on ground. Education, and we spoke about that. Healthcare. So today, I think if you look at it, our healthcare, what India has done in healthcare, has invested since a long while, has actually been probably far better than many of the other advanced countries. Like, Britain or Sweden or so many other places, people are told, if you're sick, do not come to us. There's nothing we can do. But that's not the way our country is thinking. And if you look at the proactive efforts that are taken by our countries, our ULBs, is actually appreciable. But yes, of course, this COVID situation is making us think that, yes, where are our gaps and what should we do to, better it. Housing, again, is a state subject. Labor will absolutely be impacted. And obviously the transport, right? The passengers transport, especially, of course, logistics is there, but from what I understand, there's a number of things being put in place for, the logistics transport, but for the passengers transport, it is going to get impacted. So, the question comes in, the idea is that what is it that we can do? And here is what I think, first of all, it is about opening up and operating in uncertain conditions. And hence we need to know and put in place strategies of when to open, what to open, and how to open it. right? And I think this, yeah, I mean, I've seen several, um, documents coming out from state government level in terms of how to open this lockdown. And so state governments are putting in place, I think now even the ULBs will also have to put this complete structure in place and figure out that when, what, and how. And to kickstart the urban economy, I think this, the silver lining in this whole pandemic, this disaster, is that I believe it is the time to hear what the industry has been saying to us for a long, long time, and probably help tweak our policies to really look at probably what is now being termed as the social capitalism. So if you look at even pre-COVID, our economy was struggling. And if you look at some of the things that were really hitting it, one was access to finance. Second is the jobs. Third was again all about the marginal workers, be it migrant workers or otherwise. Fourth was the disaster. We have a national disaster management agency, but in today, are there funds, at the ULB level to manage not only COVID, but maybe anything further, any further disaster that comes in, and hence can a disaster management fund be created, and capacity building, very, very important. Two things that I would, I'm lucky that, Pathak sir is here and, Kunal Kumar sir is here and we have their ears. So, some of the thoughts that I had was, let's say the central government and through its schemes, would it be possible in this time to bring in flexibility under the different programs that are driven by the center and are supported financially by the center? I mean, of course, it will have to be ring fenced, but still the flexibility will probably help the ULBs in being able to manage where they actually want and the initiatives they want to undertake. And Pathak sir, like I mentioned, so many of the things that now we will need to do to kickstart the economy at the ULB level, let's say, the land use change or approvals at, let's say a PPP structuring or, beyond the 30-year has to come to the state government. I mean, can these things now further be looked at and said that what is it that can be provided? In terms of access to finance, is it possible that instead of being looking at just EPC today, when I said that there is compassion, I mean, with that view, I also say that, all the stakeholders involved probably are ready to take a stake into any of the developmental works and say, is there a finance option that I can come up with? So rather than spending it directly, can I also be a part of it and basically leverage every dollar that is there. So four key things that I want to end this with. One, saying that I think every ULB needs to have a vision and a development roadmap to be put in place. There needs to be very, very strong tracking of this and monitoring of this vision, the development roadmap, to be able to push its agenda. The governance model is extremely important. So I, aware that there are several challenges as an administrator, several constraints that they have to go by coming in from different sides. But let's say you do have an economic investment framework put out there, and some of the key things, like Ravindran sir said. I mean, today the STPs, like Mehta sir said, the sanitation, the waste management, the key infrastructure, the healthcare infrastructure. So can those be part of the framework when we choose where we want to first invest and put our money in? I think that is what every ULB will need to have and will need a buy-in and political will supporting that. Third, the water, waste management, transport are the most critical areas, not only from a health and hygiene perspective, but also saying from attracting investments. Because if you want to kickstart the economy, we want to be able to attract investments. And hence, the final point is saying that if we do want to attract investments, the way we've been doing investment promotion programs at the center, at the state level, I think time is now that the ULBs need to look at investment promotion programs and take it up as a program to be able to attract investments into different sectors.
Thank you very much, Atul. I'm really thankful. You have given a very comprehensive presentation. In fact, you have done my job a little easy by touching on the issues mentioned by all the distinguished speakers. So I think that I need not again try and summarize the point, which I'll try to do at the end of the, towards the end of the webinar. Can we now invite questions and request the panelists to answer? So will Robin be managing or? Hello?
Yes, so we will look them up.
I think we can go in the order of the panelists, please.
You can look up at the questions that are also mentioned with your names on the WhatsApp groups that are forwarded. And if you'd like to take any of those questions, you're more than welcome. And if not, we will post the
WhatsApp group that we have created.
Yeah, with the questions. So the questions are also directed there. So you see the last question for Mr. Kushwaha, sir. It says the best practices are being shared by Goa and Mizoram. Would you like to stress on that or speak something on those states that are showcasing best practices?
So, to be honest, I have not gone through the best practices that they have shared. But yes, the question also talks about a platform for exchange of such practices. I think this will have to be a participative approach, actually. We have some proven structures of integrated, say, smart city management at city levels.
Mm-hmm.
What would we need is an integrated, decentralized approach, which means that the local entities where they are working, let them do their good job because they have that understanding of the local ecosystem.
Yep.
But they are in a hub and spoke model integrated to the central system, where the necessary parameters that are required to be fed into various decision-making levels are fed, for which I had spoken about the various standards.
Mm-hmm.
And information sharing and information dissemination will also be a part of this. And one part which probably could also be integrated to this will be the social
Yeah.
So the public that, okay, this is what is right, this is what is wrong, because many times a lot of rumors get generated, especially in case of mobilization of the migrant labor. We've seen it before in Bangalore once. So that's why I said in my discussion, when I was giving the points that in an Indian scenario, the Indian template is very, very different from any other country. So we have to look at it. Second question that has been put across to me was about how do we capture this and how do we make it foolproof. I think we are evolving. It will be an iterative process. There can be nothing which is foolproof. We'll learn, we'll make mistakes, but till that we are heading in the right direction, I think that is the way to build it. But yes, the government will need to take the lead role in that. See how the startup ecosystem can be better leveraged along with its binding with the established industry, because startup is designed to create a disruption, so they can help make good processes. But at the same time, there are a lot of big industry who have that industrial might to support that. So if we create that kind of an ecosystem where it is government, it's a government kind of program where the larger industry is supporting the startups, I think this will give life to both.
Yeah.
So this is something that I would like to suggest.
Yeah. Thank you. So let's have questions to other speakers also.
There's a question on the public transport always face viability gap funding, and that's for Mr. Kunal Kumar. If you've taken a look at that question, would you like to comment on that?
Okay, Robin. I think
provide.
it's always been the case that public transport, despite everyone knowing the importance, has been sidelined in the way urban local bodies plan their cities. And 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 it's actually something that at this moment is a win-win, because I think if they go about deploying investments into public transports, one is also push the automobile sector, which is actually going through a crisis of its own. So different models of public-private partnerships in which buses and infrastructure can be built. I think it needs to be seen in a holistic perspective, because it's not only about buying and running buses, it's about infrastructure, it's about having the right policies. For example, something like a transit-oriented development, which is what Amit was also pointing out about. How do you reorient your planning in cities? And also you will have to look at very innovative sources of financing it. But I think it's only about our imagination bringing up those ways of financing available. Carbon tax, things like that, which have been tried in all kinds of places across the world, are available. Sustainable transport is something which can be easily funded, provided we have the will to go ahead and do that. And that's something which is at this time of crisis, which I think is going to be an advantage both for the industry and secondly for the ULBs to be able to take those decisions. I think we are working on it. In fact, within the ministry, we are coming out with some quick program to be able to support cities with, I think we've been, yesterday we were in a discussion, I think we were close to putting together a fund where we can support cities by putting in place about 25,000 buses quickly. So we're trying to move fast on that. Hopefully we will be able to, make a difference in that area, which is very important. As I said, it's about access equality. People should have access to good quality transport to reach from their homes to their workplaces and back.
Thank you, sir. Thank you. It's quite optimistic on that. We have a question for Mr. Ravindran. What measures are planned after this lockdown to maintain the quality of the environment? What we see now, I think you mentioned earlier. So how do we plan to maintain that?
Yeah, this basically the lockdown situation has given the background level of the pollutants. And when you look at the particulate matters in the atmosphere, in the standards which we keep for the higher than, for example, European countries are standards for particulate matter 2.5. If it is under 100 year, it may be 30 there. Some of the countries. So 60 for 2.5 year, maybe somewhere it's very low in other countries. So that means that this background level will help us to bring out the standards which is very high in our country, maybe to the extent possible low. That's the feature we can work out. And there are, I think, other 3 questions they have posted on WhatsApp. If you permit, I can just clarify on that.
Sure, if you can quickly.
Yeah, that's one more question on that water quality. The water quality is actually because of the industrial effluents are not there, and the contamination to the water quality is water is not much. Whereas the domestic is still it is there. So this gives an sewage actually contaminate the water. So where we can give the intervention or how we can tackle those kind of situations, that also it gives the learning point for us. And the third questions, they have talked about biomedical waste. And biomedical waste, we have already, Government of India has given the rules in 2016. It's already world rules only. And they have given a very proper SOPs how to handle the entire waste management. But my point here, I just want to look at that. Half of the waste, which before becomes a waste, it is a resource. When it is handled as a resource, that time itself has to be, we have to take care of that, how to segregate it in and put it in when you throw it as a waste. So that's what I just want to point here. Otherwise, the SOP is already given by the all pollution control boards across the India, and guidelines have been given that can be very well handled actually. The point here is that how much is drilled down to the last mile handlers. For example, operators at the common treatment facility. This I think in the second week of March itself, so Maharashtra Pollution Control Board asked all the common facility operator to give proper training to their staff, as well as the persons who are handling in the healthcare establishment also. But now almost 110 or 112 hospitals, now the patients are there, our quarantine mechanism is there. But rest of the hospitals or healthcare establishment also should impact training. Then only I think the post-lockdown will be much easier to handle these things.
Thank you. Thank you, Mr.
Yeah,
Ravindra.
thank
There are
you,
many
thank you,
questions
thank you.
coming in. We'd like to post a question once again for Mr. Kumar. It says, as the crisis is increasing, so is the pressure and deficit of human resource who are a part of the frontline workers, which you know, medical professionals, health workers, etc. How do you handle such a situation of this deficit of human resource?
Well, I'm sitting at the government of India in Delhi, and I think this question is better answered by the people on the ground. Pathak sir would be in a good position to answer that. Cities are actually a lot of ingenious ways in which people have handled this situation. So I would ask Pathak sir to take this question.
Yep. Yeah.
Yeah, Mahesh, please.
Yeah, thank you, Kunal. See, actually, we have like somebody mentioned, decentralization. So a lot of powers have been given to the local level. They can do walk-in interviews. They can hire consultants and experts, doctors also. They can fill their posts. So in this period, there's a lot of relaxation, and many cities have responded and done this kind of work. So that is one thing which has happened. May I continue with some of the questions that
Sure, you can quickly comment on that. It will be nice for our attendees.
One was that essentials, that people don't come to know the plan or the situation for essential. There is basically the local grocer shop or the local mall. And so what has happened is that from the beginning we tried to give a direction that they will be open 24/7. So that was a kind of enablement. But then, as per the local situation, when they saw the type of crowd that is coming, or whether social distancing is being met or not, so then the local restrictions started coming in, and that is informed to the local community. Many like in Sangli, I know they have tried to do home-to-home delivery. Many housing societies are getting home deliveries. So and locals, then like 1,000 flowers bloom. That kind of thing is there. So essentials are they're coming to know what is happening, what is the timing, and where to get it from. Then there was a question about monsoon preparedness. So that people have been sensitized in the VCs, and they have specifically been told by the CM and by the Chief Secretary that you have to prepare for the monsoon also. So when you are trying to do all the health activities also, but you have to do these essential services, and it is easier to do now because the inaccessible areas are accessible. I think the railways have, in Mumbai particularly, the railways have done a lot of work. So this time, I hope and I believe that there will be a much better monsoon experience, and it is likely that it may come early. Although predictions have not yet come, but it seems that it's going to come in the mid of May at least. For construction, there was a question on training of construction workers, skill development. There's a separate department for that. Labor department and skill development department do it. On site also it is done. So, and most of the construction workers which are there in particularly in MMR and in Pune, at least they are quite skilled. So I can say that. In other smaller cities, I think the smaller towns and cities, there is a need for proper training and skill development. So these are some of the questions which are there for me.
Thank you, Mr. Pathak. We wanted you to also address the monsoon bit. Thank you. There's a question for Mr. Mehta. You mentioned 22% of the population of Mumbai uses community toilet. Can this be one of the reasons that COVID is spreading in Mumbai? This is one of the questions. Could you please?
I don't think so. I think it's a challenge overall because community toilet dependence in the state is very high.
Yeah.
I don't think that is the reason. I think as an urban planner, I can say that all our old planning practices of high density, low rise development, I think we now have to do a rethink on that in terms of, and today it's COVID, tomorrow there may be other infectious disease. So I think that is where the issue is. It's the density of population and the high density that can lead to difficulties in maintaining the social distance. I don't think community toilet is
Thanks for clarifying.
Now, when I have 1 minute is in terms of, I think hand washing is very important. We now need to ensure that we get water near the community toilet and install hand washing. A few towns have done it. I wonder what will happen in the next month when the water scarcity will hit in Marathwada, in Vidarbha, and other regions. So that's one issue. And second, while I have Mr. Pathak and Kunal, let's do some COVID bond for cities. If Ministry of Finance doesn't listen to us when we wrote this COVID bond, let's do a COVID bond at the city level and see how it can work. Thanks you, Mr.
Okay. Okay.
That would be nice.
Any question for Mr. Otorkar?
Mr. Kunal Kumar, earlier we didn't have that question for you. There's another question. Does our cities, do our cities need a city level risk officer and a resilience department where such discussions can happen on a regular basis? Every city is unique, so one solution to all may not be relevant. Your comment on that?
Without doubt. In fact, you see on the fringes that there are programs which are being run by global philanthropies, like the Rockefeller Foundation runs a 100 cities resilience program, and 5 cities in India are part of that program. And you see a good dialogue developing and cities developing their blueprints. If you've not heard of it, Pune is part of it. I think Chennai is there, Surat is there, and there's a lot of good peer learning that happens across 100 cities across the world. Now, why should only cities have resilience officers? I think you need to have data officers. You need to be able to you need to be able to have a proper city technology officer, and somewhere there has to be a coherence, and the kind of role that these people play should not be at the fringes, because normally happens is that these people come from the private sector, they don't get the audience of the municipal commissioner or the mayor, and they don't really have a set place in the system. They are always looked at as outsiders, and therefore they were never able to produce the kind of impact that they can. So, innovation. You see globally, many cities have city innovation. So innovation, technology, data, resilience, these are fields where cities should invest in and create spaces for new ideas and new people to come and help us.
Thank you for that. We will have a question from Mr. Amit. You spoke about the emerging technologies. How can the emerging technologies like AL, ML, and blockchain contribute to we have a poll. We'll come to the poll in a bit, in health, education, and entrepreneurial aspiration given the current situation.
So absolutely, I think this is where, again, what we spoke about, the importance of data, because ultimately your artificial intelligence, your machine learning is going to run on data. And, today the health records of an individual are not necessarily data. I mean, even a particular individual himself does not necessarily have all his data record, ever since he was born. But if we have the right kind of system where the data is captured, using the right kind of technologies, absolutely it will help us in predicting where we are going. I mean I can go on and on. There are several challenges. So, like, for example, the monitoring of the school health, of the school students, right, their health data. It used to be initially be done at the ULB level, but once the state government, I'm sorry, I'm not talking against the state government, I'm just saying that once the state government started saying that, okay, we are going to do this in a centralized manner, what used to happen at a quarterly level or on a quarterly basis started happening on an annual basis, and that data unfortunately is not directly available to the ULBs. So how do you expect the ULBs to be able to make a decision based on data that they do not have regular access to, or are able to do it the way they want it? So here are some of the things I'm saying that probably yes, absolutely, if we have artificial intelligence and machine learning for all of these kind of things, it automatically is going to help us. I mean, even today, through all the principal secretary health, the Ministry of Family and Family Welfare and Health, I mean, they've released a forecasting tool which everyone is using to forecast the need of their beds, their PPE equipment, etc. So again, what is that? It's a tool, and ultimately, you do this over a period of time, and you want to be able to use that data. You need AI and ML. So beyond doubt.
Thank you for that. We hope we move to that level. I'll over to you, Mr. Jain. Just before the poll, we just put up a poll saying, when do you see the lockdown? So we have around 300 plus attendees saying that June 30 is what they feel the lockdown will be completely lifted. And it's still very debatable, and we'll wait and watch. We hope that this ends sooner than the times mentioned. I'll leave it to you, Mr. Jain, to take it forward and close the session.
I think we have come to the end of the webinar now, and I'm thankful to all these speakers for sharing their thoughts on a very important subject of the impact of 90s and how they are coping with it and how they are expected to cope with its future impact. Now, it'll take a lot of time for me to summarize all the points, but what has really stood out in the discussion, more resilience in terms of empowering them, decentralize functions and powers to them, and more importantly, empower them with adequate resources. There was discussion of utilizing the grant of 15 Finance Commission, or we also had suggestion of COVID bonds. But it's very important that we need to really empower them financially. And if they are not having adequate resources, I don't think that they will be in a position to cope up with the future impact. The second point which stood out during the discussion was that we need to have a city-level roadmap for short-term, immediate, short-term, medium-term, and long-term. COVID-19 or some different avatar of a contagious disease, may be there. They were there earlier also. So we need to have a short-term, medium-term, and long-term strategy at the city level. We could have a resilience officer. We could have a flow of data mechanism. We could have better technologies available with the cities. And at the same time, we should have a national response mechanism, national response system, which looks across cities and villages, which looks across the different sectors of economy. And another very important point was that while we are still debating when the lockdown will be open, there was a poll just now. But then one thing is very clear, that you cannot ignore anybody during time of crisis, during floods or some other types of crisis, just because he or she is having COVID-19. So we need to develop, we need to have a strategy, we need to have equipment, definitely, to cope up with this kind of a situation. A very important point initiated by Mr. Kunal Kumar was that we need to prioritize infrastructure investment. We need to invest more in health, we need to invest more in education, and use digital technology over there as far as possible. And also in the case of informal settlements, I think we need to look at how the community toilet concept could gradually give way to IHHL, a term used by Dr. Mehta. In fact, I must share that what Brazil has done, the favelas have done, is to go for individual toilets. Each dwelling unit, we could perhaps think on those lines also. Use of digital technology, of course, it came in the last webinar also, and today it has stood out a very, very major issue that it has really emerged. And let's use it more constructively to make our cities more resilient, more efficient. In terms of environment, there's a good news given by Mr. Ravindran that air quality is all-time high, good. Pollution has gone down. I saw the item of the news that Ganga water somewhere near Rishikesh, etc., is potable water. One can even drink it straight away. So this is something unprecedented in recent times. And I think with this new baseline, as I said, I think let's have a strategy how not to allow pollution to come up again. Maybe we can, right from the beginning, as Kunal said, 22 or 25,000 buses are coming. So similar such measures, let's take it as quickly as possible so that pollution doesn't trigger once again. So with this, I bring the webinar to a close, and I once again thank all the speakers for spending their valuable time and contributing to this discussion. Thank you very much.
Thank you, Mr. Jain. Thank all the panelists on behalf of All India and IFAT. We have Utkarshka Madam, who's going to propose the vote of thanks.
Yes, thank you, Robin, and thank you very much to the moderator, Mr. A.K. Jain, our own mentor from ALSG, and all the esteemed speakers. It's nothing but our pleasure and honor to have you all on the panel. And I'm sure it's a treat not only for me, but all our attendees to listen to you on your thoughts and experiences on this particular subject of impact of COVID-19 on urban development. And we got to learn how cities are tackling the pandemic. So thank you very, very much. The discussions certainly were very insightful. And so we would not like to stop here, but we would like to convert these discussions to something like a policy note or policy brief. We would be ready with that very soon. We highly appreciate the time that is spared by all the speakers with your super hectic schedules in these difficult times, especially. So thank you very much for being here and for your excellent insights. The response is quite evident through the number of participants who have joined us and also the responses that they have shared online and offline. So thanks to all the attendees and the participants as well. So thank you very much. Many thanks for joining us. This was really very insightful.
Thank you.
Thank you.
Bye-bye.
Thank you very much.
Bye.